Hello, I'm Dr. Craig Escude. Welcome to Medical Monday. Clinical Pearl number 46 from the book Clinical Pearls in IDD Healthcare talks about mental health conditions in people with intellectual and developmental disabilities. It can be really challenging to diagnose a mental health condition in someone who has difficulty communicating with words. How do we know what someone's feeling if they can't tell us that they're feeling sad or that they're feeling lonely or anxious, or if they're having psychotic symptoms like hearing voices? If they can't tell us these things, it can be really hard to diagnose. So what we often look for are behaviors that might point to a psychiatric condition. But one of the things that I have to caution you about is we often look at people with behaviors that are adverse or difficult or challenging, and the tendency is to think, oh, they're having some mental health issue, or we need to put them on some medication to simply control these behaviors. And that can lead to a lot bigger problems, because sometimes those behaviors are a way that the person's trying to communicate that they might be having pain from a medical condition or something else. And then they get put on psychotropic medications that just really mask these symptoms rather than treat the underlying cause. It could also be a simple environmental cause, like the person doesn't like the people that they're with for the moment, or the new home that they've moved into. So they're exhibiting these behaviors, and we must really use caution in thinking, oh, well, we need to use a medication to control these behaviors. But once something is ruled out, let's say we rule out all of the underlying medical conditions and environmental conditions, we can still use certain clues to help maybe point to a mental health diagnosis. So some of these things might be like, if we see a particular behavior that occurs in any environment, so it's not just specific to, say, a certain person or a certain place that the person doesn't like, that these behaviors just occur wherever and whenever, that could point a little bit more towards a mental health condition. You know, if there are behavioral strategies that you would typically expect to work that are no longer working or have been ineffective, that might point to it being a little bit more of a mental health condition. Also, if the person really doesn't appear to have the ability to control their behavior, they aren't able to say stop it and start it at will. If we see a person being able to stop and start their behavior, that might be because they're, again, trying to communicate a dislike or a preference or something like that. But if they really don't seem to have the ability to control their behavior, not always, but possibly that could lean a little bit more towards a mental health condition. Sleep patterns are something to consider. We know that people who are depressed either want to sleep more or sometimes they don't want to sleep at all. If they're having anxiety or if they're having panic attacks or manic episodes, people may not want to sleep at all. So if we see a big change in a person's sleep patterns, that may lean a little bit more towards mental health conditions. But there are other things. There are medical conditions that can mess up sleep, such as reflux that might keep you awake at night, or pain from something else. So again, use a lot of caution before just saying someone has a mental health condition. So we're going to talk a little bit more about this in the next episode. So thank you for joining us today, and tune in for the next episode where we'll hear a little bit more about how to tease out mental health conditions in people with disabilities.
Hey everybody, thanks for watching this episode of Medical Mondays with Dr. Craig Escude. We got a ton more in the backlog, so if you want to check those out, we got a playlist on YouTube, or you can listen to it on our podcasting platforms. We just want to make a quick note that Friends for Life is currently hiring, so if you'd like to come work with us here at Friends for Life, head over to friendsforliferc.com, go to our employment page, fill out the form, and we'll get back with you soon. And we also have a new show airing now called Nursing in No Time, kind of as a compliment to these Medical Mondays. So if you'd like to check that out, also available on our YouTube channel. And as always, you guys can check out the Friends for Life podcast and our midweek minis. So thank you for watching. We'll see you next week.